outside support or the lack thereof have on a person during the transition stage from prison back into the community. I have added a reflexivity statement because the idea for the study began in the summer of 2014 while completing a research methods course with Dr. Jennings. And my interest in this field is a personal one. I have myself had to do the very personal transition myself. And I have spent a couple of years now on campus, and I have also had the pleasure of researching and putting a lot of work into this area through this department and having the help of a lot of people to really understand the impact that this has on people's lives. So I also know that the validity of my research will be questioned. And so I did make sure that during this process, I followed a lot of steps and made sure to add a lot of theoretical components, made sure to meet with my mentor during the steps of this, ask and express my feelings about certain things. And so I thought that was a very important part of the research to include. The landscape of reentry. The numbers are astounding for this. We have seen an increase sixfold over the years since the 1970s. But what's more tragic is the amount of people who return to prison. Within 5 years, there's over a 75% return rate for people who return to prison. The problem that I have with that number and why I decided to take this on is that there's no one way that we gauge this number. Everyone in the field uses the term recidivism in a different way. So is it a return to incarceration due to a new crime? Is it a return to incarceration due to a technical violation? And a technical violation could be you stayed out after curfew because you were on a term of parole or probation. Did you not have housing, which was a big one that I undertook in this study? So if you're homeless, in Minnesota, I interviewed a Department of Corrections supervised agent who oversees our intense probation and parole in this area specifically. And the homeless population, when they return, if they cannot find housing, so that we protect our community, they are returned to prison. And they're returned to prison until housing can be found for them. So how do we term recidivism? 76% is a high number, but if we were just doing quantitative measures, is that fair to say that our offenders are offenders? Because that is a community problem. Are they failing because we can't find housing, because they can't find housing, because we've done labeled them prisoners? We've done labeled them a risk to society. The research question that I wanted to undertake was, how do people interpret the role of social support, or its lack thereof, in their reentry process? Not how do we as a society. That has been established. That has been greatly established how we as a society interpret their success. There is a plethora of literature that establishes what success is for them. And sadly, it is not great and it is not positive. So I wanted to know, how do they interpret the role of support? And the thing is, it's hard to gauge what social support means, because that is one thing that does not have a huge academic literature behind it. There's not a lot. Social has support. Social has support behind it in literature, but as far as reentry goes, there's not a lot. But there is, Cullen undertook this, and he came up with 4 dimensions that include what social support means. And he found that within those 4 dimensions, it came down to there 4 dimensions. But one of them that really stuck out to me was a formal social support might be provided by schools, governmental assistance programs, and perhaps the most interesting was the criminal justice system. Because if you've heard me talking, it seems like, well, that's something that's holding them back. it's something that is probably counterproductive to the reintegration process. So I was looking at this and I was researching and I thought, well, that's very interesting. So I wanted to see, when I was talking to people, because I used a pre-established questionnaire that we had gotten IRB to approve, and I was letting them answer the questions. Was that going to be something that they interpreted as part of their success? So according to Taylor, oftentimes former prisoners' ability to successfully reintegrate is dependent upon their ability to tap into opportunities, emotional guidance and support, and other important resources. And another thing that I thought was going to be important in here was, Peter Seelig undertook this, she's very well established over 30 years in this field, and she undertook a research project that looked at both sides of the reentry aspect. And what she did was, she looked at this from an academic standpoint and a rehabilitative standpoint of practitioners in the treatment segment. And she looked at what are they doing treatment-wise and what are we doing literature-wise. And this is what she found. She said she researched prior literature on reentry and concluded that correctional practitioners are working hard to identify and implement programs that reduce reoffending after prison. At the same time, academics are trying to amass a body of literature that will guide practitioners' choice of programs. Yet, when one looks closely at the two enterprises, there's little evidence that research is driving policy or that policy is driving research. And at the end, she says, everybody's doing what they want to do for their own good, and no one is looking at the offender themselves as an individual, because everyone has their own agenda. And so that's what she says isn't working. And even her as an academic says, we need to be doing more as a collaborative unit to work for what's working for the individual, not for what we believe is working in numbers or in dollars or in whatever. We need to see what they are saying. We need to see what they say works. And I thought that was interesting because that's what I was wanting to go out and do. So my sample was the perceptions of the role of social supports from 9 formerly incarcerated women and men residing in North Dakota and Minnesota. And I also interviewed a 9-year veteran with the Minnesota Department of Corrections who oversees the intense supervised parolees in this area and a 16-county area throughout all of Minnesota. He's been doing that position, like I said, for 9 years. So he sees mostly like the high-risk sex offenders that are all on level 3, anybody coming out on boot camp programming, murderers, all of those that are deemed the highest risk. I used an in-depth interviewing method using a semi-structured questionnaire that was administered to each subject. Epistemology was a phenomenological approach which focused on the participants' lived experiences and the meaning that they themselves attached to their lives. So, from incarceration to stabilization, the immediate point of reentry is something that was very important to most of these participants. Housing was an immediate necessary form of support that each person received at the initial stage of release. The aid that participants received with housing was not always welcomed, but they did understand it was in their best interest to facilitate a successful return. And here was one of those big ones. Governmental assistance in corrections as a form of support. So, halfway house was a form of support within this area. It was something that 3 of the participants didn't want to do. They saw it as necessary. 1 chose to go there, even though she didn't want to. And one of the big factors was she had been in prison for over 7 years. And she knew that it was going to be a failure for her to return to her area, which was in North Minneapolis. And she knew that there was nothing. She had been in the system since she was 13 years old, had lost all of her children essentially, was rebuilding all her relationships with her family, and she said, I have been arrested over 50 times. I don't know how to be non-institutionalized. I know I need to go somewhere where I can remain in a daily routine. It is instrumental to me being successful this time. She now owns a home, has a stable job, and has been out for 6 years. She has had no returns to incarceration. And when I met with her, she has a better house than mine, better car than mine, 2 beautiful dogs, and I was just amazed. I was like, well, you go. And the fact that she had this knowledge was amazing to me. And here's what she had to say. I was very angry. I was very fearful. I was afraid because I didn't want to go back to prison. I did not want to go back to prison no matter what. I needed the structure that I had at the halfway house, but at the same time, I also resented the structure because I felt I had paid my debt to society. But I did not need that. By the grace of God, I made it through the program because I almost got kicked out. And she almost got kicked out for having her cell phone past the time that she shouldn't have had it, which shows some of the structure that they do provide, because it's a rule. It's rules that they don't like, but it is a rule to help you get reestablished back into the community. Interpreting assistance and supports. Participants identified feeling their most important types of support were received through community aid and pro-social supportive relationships. 1/3 of the respondents identified with having little to no family support. Those had a harder time in transition. My mom has been my biggest support through this whole ordeal, and my fiance. I actually met him while I was in the halfway house, and he's been a good friend, a good boyfriend, but just a good support. He's someone for me to talk to, and kind of an outsider looking in. I didn't have a significant other. My family, my daughter, my sister, my aunt, my family have always supported me. My family's been nothing but supportive in every way. Or the lack thereof. Yeah, well, my family's very dysfunctional. They have their own issues, their own addictions. My mother's currently serving 15 years in prison. So she's not a source of support, because she has her own issues she's dealing with. My father has health issues and addiction issues. He's supportive to the best of his ability, but he is not in a place where I can really rely on. My other family members, it seems like, that kind of cloud of judgment. They know that I got in trouble, they know that I got a felony for selling drugs, and they kind of just hold that over me. And so they don't speak to me because of it. They just figure they go on about their lives. They're not concerned with anybody else. I didn't have any friends. That's the way I kind of stayed. It was very sheltered. My family, really wasn't that supportive. They figured out, well, you're big enough to do it, so you're big enough to suffer the consequences. Not going to do anything for you. And so it just went from one thing to another with the family situation. It just got worse. I don't even talk to my family anymore. I haven't talked to my mom in 2.5 years. Now, and the last time we were there, it was for Christmas. It wasn't the greatest episode. It was kind of bad. Those last 2 were 2 of the 3 that had a return to incarceration after release. They were 2 of the only 3 that had no family support. And those are things that you cannot find or lie about in numbers. My problem with was when I was asking these questions, they weren't immediately available. Because one of my questions was, did you have any type of assistance or support upon release? I had to talk for a little while more before some of these things kind of came out. And our research, how much research actually gets that deep before people are going to open that up? And so I worry that when we are studying this issue, how much is getting lost in these people's lives? How much is getting lost that we don't know? How much is it that we are not looking at the root problems for things like this? Building a community of support. The concept of collective efficacy is the level of acceptance and cohesion that is built within a community. Builds the social capital of an individual. This happens when the community that a person is a part of comes together to accept the person back and help them solve the problem at hand. This became evident within the narratives of the participants and the parole agent. Community acceptance as a buffer. And these were some of the things that, when I looked at, if there's not enough family support, and I asked, well, what do? Do you have any friends? Do you have anybody else you can speak to? Where does the community come in to help those things, and are we doing enough? And this one is the woman that did return. They helped me get through a lot of things. I mean, they were there. They weren't there to, be kind of snotty. They were there to really help people and push and hold them up when they need it, for like employment, gave you leads for employment. She's speaking about an Al-Anon club or an downtown that she found, just as a community group to go to. So that was her only family. She didn't have any real family. And this gentleman speaks of the jail chaplains program in Cass County that he found while he was in jail there. And he's still part of that program now. He goes to church at First Assembly. He does a mentorship program through them. They keep tabs with him. They facilitate meetings with him, Bible study. And that was his form of support. All 9 participants mentioned having contact with at least one form of community agency that lent them support during the transition. Some participants are still currently receiving an amount of minimum support. Fisher and Travis emphasized the importance of community influence on the transition from prison to society by acknowledging that the social structure features of neighborhoods may also have an effect on individuals post-release. So how we build within our community has a lot to do with how people are building within it. So if you look at communities that are segregating themselves, that are broken down, they do not lean on each other, crime rates are higher in those neighborhoods. That has also been shown over and over. And these go on to talk about the amount of support and how they came. Public assistance was given through medical benefits, food stamps. They didn't have any cash. One woman went to Dress for Success. They gave her uniforms to go look for a job. And she said that was really important to her because she didn't have any clothing. She felt embarrassed to go and show up for a job when she had nothing to wear. The halfway house didn't pay for, she had no money, but it was $1,500 a month. She got that through the county assistance called GRH, which is Group Residential Housing. I know how important that is because I work in a treatment center. And we can't take patients unless they have insurance. And our insurance comes through the county and they pay for that. Insider perspectives, this comes from our agent. When I asked him, I used the same instrument, but I asked it from his perspective, how he viewed these situations. And he said it would be great if we had more, some type of employment. I know the workforce center is great as well, but as an agent, I spend a lot of time practicing interview questions. There's an individual that don't know how to answer questions, they don't know how to approach the Dress for Success. We have individuals that have had to seek out professional attire. Medical assistance is huge. It's another focus of the DOC right now. It's to make sure everyone has at least applied for MA prior to release. The medical, having someone able to obtain medication needed, medical services needed, and the counseling service needed to be successful. That should be a no-brainer. So what influence does outside support, or the lack thereof, have on a person? The participants feel it was important to their transition and success to have a support system and financial help to establish themselves back into the community. It was important, or otherwise, I probably would have been back on the street. It was all important because, I left prison, I was probably $800 or $900 worth of medicine. Without medical assistance, she was on mental health medications, is what that was. It was extremely important because, when you get out of prison, most of the time, you only have $500 gate fee. Gate fee is the money that you work for yourself while you're in prison. The prison doesn't give it to you. Over time, you're working and you're saving it out of the labor you're doing in prison. I think it was very important. It's embarrassing to have to tell someone you've been in trouble, at least it was for me, that you have a felony. And that speaks to the shame and the label that is placed on you when you are in incarceration and then released. Having a support buffers that. Because I had the support that I had, it didn't really bother me that much. My mom, she bought a house basically just to help support me. So those who have family support don't suffer as much in the community because they have that. And that's important to remember. I just feel that it probably would have took longer if I had took the initiative, beforehand, if I just waited, you know what I mean? It would have took for myself to get back on track. And this was someone who had no family support, had returns to prison afterwards. But he was on his own, and he had to take the initiative to do it all alone. Not having and knowing that I got to work hard for me, it's more of a rewarding feeling for me, like I accomplished something that actually been given it to me. This person also shows that having no support, though, is good for him. Something he's working for, something that he's got to strive for on his own. It's extremely necessary, because if it wasn't for that, I think, my biggest thing is if I become helpless. if I feel helpless, like I don't have any control, then I'm going to do something to try to gain some control. That shows the necessary component of support, because that shows that there is a potential for recidivism for this person if they did not have it. If I didn't have it, I could have been back. You know what I mean? It's having somebody to come to light if you're messing up or whatever. If you look at everything that they're talking about, it's that buffer just to have something to help you succeed. And these all comes from their feelings of support, no matter what that support was for them. And here's another insider perspective. When asked about what he felt was the most important part of reentry, I look at this probably a little bit different than most. To me, it's always the pro-social support. It's the companion piece. Housing and employment is something that we have always focused on in the department and very important. I'm not saying it's not important, but what research is showing is that housing and employment are not big indicators of recidivism. The biggest one of the biggest indicators is the pro-social companion. That pro-social attitude, and we can't affect the attitude directly. Over time, by addressing the thought process, we can get to the attitude, and the big part of that is the pro-social companionship and the pro-social support. I want to keep in mind throughout this that he works with the highest risk offenders for 9 years. And that's got to be taken into account of what we see in our own home area, because it hits home. He's dealing with the people we live by and with. Here's my own insider perspective on what I've in my own life. Since my release in 2010, I've amassed a number of accomplishments, both personal and professional. I've earned a cosmetology license, and I've been recently accepted into a graduate program here at MSUM. My husband and I are homeowners and business owners. Our children have had the privilege of attending a local private school, and the oldest is in college, also a proud Dragon. I currently work in a residential inpatient treatment center where I offer support services to individuals with co-occurring disorders. I've shared my story of transition from prison to reentry with others as a mentor, often returning back to the Minnesota Department of Corrections, where I graduated from. I've also shared my story publicly in a number of different open forums, none of which have been possible without the aid I received from multiple agencies within the Fargo-Moorhead area. During this time, I was also transitioning and dealing with reentry. A continuous theme within the narratives of all participants was the existence of a form of social support. For those that lacked family support, they leaned on community resources, friends, and even employers. The importance of family support made transitioning to the community easier by having an emotional support system. The more support systems surrounding the person during the initial period, the less stressed participants were. Those with family support experience no return to incarceration. Social support is described by calling reduce the likelihood of a return to prison. Community acceptance and the desire to help solve problems together rises the collective efficacy of the community members. Thank you. Do we have any questions? It was used a snowball sampling method, so I did have contact, I had knowledge, personal knowledge of 2 of the people. And with those 2 people, I said, if you know anybody else who would still like to, speak on the issue, let me know. And so they contacted me directly after that. Especially, the males were more hard to get in contact with or wanted to speak, and so it was harder to get in contact with them, but they eventually, because like I said, I work within the reentry area, but I didn't contact it's just people I already knew, and then said, this is what I'm doing, and this can really help us to understand the issue. If you know anyone who wants to talk, just let me know.
Thank you. If you have evaluation forms that we've been passing around, they go right to Leane. Can we thank Leane one more time for her important research?